Introducing RESTORE2, a deterioration and escalation tool for care homes.
This video is designed to support you rolling out RESTORE2 into care and nursing homes. There's a clear pathway that can be followed so that you get the best outcome from using RESTORE2. Before you start implementing RESTORE2, it's really important that you have stakeholder engagement. Leadership in your care home is key to the staff embracing and sustaining RESTORE2. Make sure that you outline the huge benefits for homes of using RESTORE2, including improved resident welfare and safety, greater staff confidence, better communication skills, and protection in court, safeguarding and coroner's cases. Get your local GPs on board so they understand what you're trying to achieve and how RESTORE2 can support them delivering their responsibilities. Also make sure that your local support services such as NHS 111, GP out of hours and your ambulance trust know that you're going to be using News and the RESTORE2 tool. Staff in your home also need to understand the benefits and embrace frailty. We recognise that residents in care homes are at risk of sudden deterioration, and that's why RESTORE2 is so important. Before you start rolling out RESTORE2, ensure that everyone understands their responsibilities by going through a social contract with the home. This outlines what support the home will receive and what they will do in return when rolling out RESTORE2. There are a number of online training packages that can also help with staff, such as the News training package and new packages from Health Education England. Ensure that staff get refresher training on basic observation and that kit is calibrated and maintained well. When training for RESTORE2, use lots of scenarios. These help to embed the learning from RESTORE2 and particularly the calculation of news in the minds of staff. Once you've trained staff, try to go live with RESTORE2 as quickly as possible so that staff can practice what they've learnt. There are a number of top tips for rolling out RESTORE2. It's really important that staff use the What's Normal box on the second page of the tool. This is about the residents' wishes, what's appropriate for them, and what's normal for them. You can fill it out yourself or with visiting professionals, and it allows you to know what you should do if that resident deteriorates. Remember that RESTORE2 is a legal document. Each box should be completed, be legible and signed where appropriate. When staff are escalating, remind them to fill out the SBARD action tracker because this captures what they've done, who they've communicated with, and can defend them if there are any legal actions. And always get ambulance staff to take a copy of RESTORE2 or a photograph to transmit to the hospital. It's very important that the hospital can see what interventions have occurred in the community, but make sure that you retain the original copy for your legal records. Once you've rolled out RESTORE2, make sure that you've got local champions doing regular audits and supporting staff and giving advice on the shop floor. This will help you embed RESTORE2 faster. Don't expect perfection. It takes a while for staff to get used to calculating news, using soft signs and using SBARD communication. It's a major shift and it will take staff time to get used to it. Remind staff that when they give a news score, they're talking to another professional using a common language. And also ensure that staff practice using Restore and SBARD in their handover meetings. Lastly, when you roll out, make sure that you collect lots of case studies to show the good outcomes and feedback to staff. It's really important that staff are praised and rewarded for new work and innovation. Use the evaluation tools to show both qualitative and quantitative improvement and celebrate success when homes are signed off as fully ready to use RESTORE2.
RESTORE2 is free to use and is available from the West Hampshire CCG website or NHS Creative. RESTORE2 has been designed to support carers to recognise and respond to physical deterioration. It was co-produced by West Hampshire CCG and Wessex Patient Safety Collaborative. It is free to use in its entirety and must be acknowledged if used as source material for other tools.